I perform plastic surgery and reconstructive surgery around the eye. So patients come to see me who may have had a history of trauma to the eye or around the eye. I also treat patients who may have a history of thyroid eye disease. So when the thyroid affects the eye, it affects the tissue around the eye. I also treat patients who may have age-related changes around the eye. They may have loss of elasticity or droopy eyelids that affect their vision or affect the function of the eyelids. The goal of surgery is to improve function, and because form follows function, things that work well tend to look good. Oftentimes there's little or no evidence that they've even had surgery. Their friends or family may comment that, wow, you look great, or your lids look like nothing has been done. And they're very pleased and happy to know that not only did we restore the eyelid back to its normal look and function, that their vision was preserved or improved by our procedures.